Hello guys, welcome to my channel. I will make videos that cover all you need to know about medical doctors and medical students. If you're new to this channel, please do well by subscribing and turn on the bell notification so you don't miss my new videos, which I post twice weekly, as on Tuesdays and on Saturdays. And to my returning subscribers, thank you for viewing this video. Thank you for returning. I really appreciate your efforts. We are growing. As of this week, I had hit 850 subscribers. That's huge. That's very huge for me. So thank you. In today's video, we're going to talk about 7 seemingly innocent symptoms or observations that could actually be suggesting way more serious conditions. And the reason I'm doing this video is aimed both at the medical doctors and at the patients. For the medical doctors, is to help you really take time to manage your patients properly. Don't just throw things off. Don't just dismiss things quickly, because there are now news that are coming that patients diagnosed with serious health conditions had actually sought the help of their doctors prior to that, but then these symptoms were being downplayed and later found out to be devastating diseases. And many times the patients really have just a few months to live, and that affects negatively the kind of confidence or the kind of belief that patients have in us, because one of our main purpose is to be able to catch things very quickly and then treat them. The earlier you're able to catch a disease, the better the outcome is most times. Then for the patients, it's so you don't downplay these illnesses. You might just see them and take them not to be serious. However, by the time you come to present, it will be something that might not really be reversed. It might just give you just a little time to live too. So please, this is to help both the healthcare service provider, that's the medical doctor in this video, and the patients to be able to arrive at this diagnosis quickly. Please, this video is not to scare you, because it can be quite scary, but I'm just doing this video to help establish the fact that even when you feel very well or you don't have seemingly serious illnesses, you should still go and see your medical doctor. That's why I made a video about seeing the doctor for general checkup. If you've not watched the video, you can just watch it after viewing this video. So let's dive into today's video. The first is having a positive pregnancy test result as a male. Ideally, it's the women that do the pregnancy test, because so when you happen to be a male and you maybe use your urine sample, your blood sample on a pregnancy strip, and it turns out positive, which is unusual because the hormone which is high in pregnancy is not detectable in males. But then it happens in some conditions that males come out with positive results, and it's usually a sign of a cancer, a testicular cancer. So please, if you have done a pregnancy test as a male and it turns out positive, go and see the doctor. Testicular cancer is not common compared to other cancers. It happens in like 1 in 250 males, compared to prostatic cancer, which is the commonest cancer amongst males. The incidence is usually 1 in 8 males. And testicular cancer is very curable, so the earlier it's being caught, the better it is for the person affected. The reason for that is that testicular cancer causes a surge, a very high surge of human chorionic gonadotropin, the HCG hormones in the blood, and then it's picked. It's the same hormone that is being picked by the test strips to yield a positive result. It is found among those within 15 to 49 years of age. So unlike the prostatic cancer that is found in the older age group, this is usually in the young to middle age group. So do I suggest that you try to run a pregnancy test as a male? Maybe, especially if you have a family history of such things. Please just try and see the doctor. So if you happen to do that, see the doctor. The symptoms could include a swelling or a lump in either of these testicles. There could be collection of fluid, there could be pain or discomfort, in the testicles or the scrotum. There could also be pain in the groin, the back, or the abdomen. Another thing is that it could also be caused by another cancer that is not peculiar to males alone. The pulmonary choriocarcinoma is also another condition that causes a surge in HCG. The second seemingly innocent symptom to look out for is persistent headache. Yes, almost everybody experiences headache with varying frequencies and severity. But then know this, that about 5 to 10% of the general population never experience a headache at all. I'm not one of such. If you are, well done. And the commonest physiologic cause is stress. It could also be as a result of something that has to do with your brain. But then do you know that headaches are also caused by ophthalmic pathologies, or there are ophthalmic causes of headaches? So it's weird for you sometimes to have headaches and then the doctor will refer you to an ophthalmologist. And this could range from refractive errors like myopia, that's short-sightedness, hypermetropia, long-sightedness, or astigmatism. It could also be as a result of presbyopia. It could also be as a result of cataract and glaucoma. And this all have to do with the eyes being stressed to be able to see properly. So you use more effort to be able to see things properly. So the strain usually causes you to have a headache. It could also be due to some serious eye conditions too, like ophthalmoplegic migraines and posterior communicating artery aneurysm. Please, when your doctor refers you to see an ophthalmologist because you have a headache, he or she knows what and why they're doing whatever they're doing. It has nothing to do with your head or anything, and just have everything to do with your eyes. The third is easy satiety. That means you get satisfied after eating just little quantity of food. Ideally, everybody has different quantities of food they eat due to many factors. Some eat more than others, some eat less than others. But then many times again, eating way less than expected could indicate a very serious condition. Recent studies have shown a very strong correlation between anorexia, especially anorexia nervosa, and cancer. It could be as a result of an underlying gastric cancer, because normally when you eat, there's a way your stomach is being stretched, and when it's stretched to a certain level, it sends an impulse or a signal to the nerves to tell your brain that you're okay. But then if you notice that you are not eating as often as you should, and it's especially when it starts telling your body you're losing weight, please try and see the doctor. Dear doctor, if a patient is complaining about that, don't easily dismiss it as anorexia or psychological issues too. Although many times again the psychological factor could make you even refer to the psychiatrist to review. But then don't just dismiss this, because it can be a serious problem. Another is persistent chest pain. Chest pain usually has more serious causes compared to headaches, because they are physiological or normal causes of headaches. Unlike chest pain is usually not due to physiologic factors, but then the pathologic factors, that's the disease factors, can be very, very mild ones, such as a reflux disorder. We call it a gastroesophageal reflux disorder, or mild peptic ulcer disease. Sometimes it could be as a result of just a strain on your rib muscles or some abrasion or trauma to the ribs. And also asthmatics experience chest pains. But then frequent chest pains could be as a result of pathologies to the heart, to the lungs, and sometimes the esophagus. So when you're having frequent chest pains, please don't just sit down at home and take analgesics, especially when they're becoming very, very frequent. See the doctor, and the doctor should not also downplayed, except the doctor finds solid reasons to see that there's nothing really serious. But so please insist, it's your life. Another cause of it could be a cancer, especially skin cancers. One of the commonest places that skin cancer spreads to is the chest. So it could affect the lungs, could spread to the lungs commonly, and then spread to the brain, the liver, and other parts of the body. So please, when you're having persistent chest pain, especially when it's associated with difficulty breathing and other things too, don't downplay it. Don't just take painkillers and move on with your life. Go and see a doctor and be investigated, be seen properly and investigated as need be. Another is if you observe a lump in your breast as a male. Okay, yes, breast lumps should not be played with for either sex, but then as a male, the lump is way more indicative of a serious problem compared to a female. The commonest causes of lumps could be as a result of breast tissues, which we call gynecomastia, or as a result of fatty tissues, which we call lipoma, or even fluid, which we call cyst. But then men experience breast cancer. If you don't know that, know that. The CDC reports that out of every 100 breast cancer diagnoses, one of them is a male. And usually for many females that have a lump, most times it's usually a benign growth. But then males' lumps or male cancers are usually very aggressive and they have to be taken seriously. So please, if as a male you observe a lump on your breast, try and see the doctor. Don't even try and see the doctor. See a doctor. It could save your life. Please, I'm not just saying this for the males, to the females, but then for a male, if you notice this, it's way more serious than you should even downplay, because men are in the habit of downplaying a lot of things that are going wrong with them. Risk factors include age. It's common among the older age group. A family history of breast cancer. If you have a relative that has breast cancer, especially if it's a male relative too, you are likely to come down with breast cancer. Then if you've gone through some testicular trauma or testicular pathologies too, you might be at risk with breast cancer. In the past, prostate cancer was being treated with estrogen containing drugs. So for a male, if you're in fact, even for females, high estrogen exposure is something that predisposes you further to breast cancer. Overweight and obesity too have been linked to breast cancer. So please, if you're overweight, try to walk. Know your BMI and walk towards it. So see a doctor. Go to the hospital. The next will be if you have a fruity breath. It's something that everyone will want to aspire for, when you can breathe and then it's pleasant smell, fruity smell that everybody's perceiving. We see toothpaste advertisement or mouthwash advertisement that usually promote this. But then having a fruity breath smell is not a good sign usually. We live in a world that everybody wants to try as much as possible have a positive body image. They usually appreciate positive body perception and want to smell nice instead of smelling disgusting. In fact, there are pills now that are being marketed to make your farts smell pleasant. And halitosis is still an issue amongst people. About 2% of the whole world population, I think about 2.4% of the world population, according to the National Institute of Dental Research. So this might seem like a very good thing to happen to you, but it isn't, because the commonest cause of fruity breath is diabetic ketoacidosis, or DKA. It's a complication of diabetes. It's commoner among those with type 1 diabetes, but then has been seen among people with type 2 diabetes. It's as a result of acetone. Acetone is a byproduct of ketone metabolism. Due to the fact that in diabetes, your body is not having enough sugar to use, it might want to break down other sources of sugar to utilize it for energy production. Part of it is the fats that you have. Then they've been broken down to ketone and acetone. So the acetone is responsible for the smell, the fruity smell that you have. It's a life-threatening condition, and if interventions are not sought immediately, the person could lose his life. So other symptoms will include difficulty breathing, excessive thirst, excessive urination, body weakness, confusion, drowsiness. This happens among other things too. So if you notice that, especially if people perceive that in you and you're not using any mint or any fruity mouth product, then please, especially if you're diabetic. Some don't even know that they are diabetic. I had, in the course of practice, diagnosed a woman with diabetes. I remember she was being referred to us because the person that referred her was suspecting she had peptic ulcer disease. But then our normal routine is also to do random blood sugar, and it was unrecordably high, and we had to start bringing it down. And that was when she discovered she was diabetic, and she had already had GI symptoms. So many people might not even discover they're diabetic, and then will start presenting with these things. These are usually people that don't go for general checkup, and you present with these symptoms. When you have this, it's not a good sign at all. So this is not something you want to experience, please. The last is worsening or progressive bad handwriting. Okay, yes, doctors are known to have bad handwritings. I happen to have a terrible handwriting, and it had nothing to do with medicine. Right from when I was a child, I had one of the most terrible handwritings ever, and medicine further enhanced it. So maybe this will be tricky for doctors, but then if your handwriting is getting increasingly worse over time, or it's getting increasingly smaller too, it's called micrographia, it could be a sign of Parkinson's disease. Parkinson's disease is a progressive neurologic disorder. It's a brain disorder that is associated with uncoordinated or unconscious movement. So you cannot coordinate your movement. You could suddenly have either jerking movements, or you cannot even move at all. So it's associated with stiffness of the body, it's associated with tremor, and it could progress to difficulty walking and difficulty even in talking. A common public figure that was diagnosed with Parkinson's disease was the late Muhammad Ali, and that was as a result of numerous trauma that he had experienced, head trauma in his boxing career too. So if you happen to experience this, don't just write it off. Please try and see a doctor too. It could be a sign. So these are all the 7 seemingly innocent signs that might point to very serious conditions. What do you think about the video? Is there anything that you really appreciated? Is there anything that you think I didn't really do justice to it, or there's something that you really disagree with? I want to know in the comment section. I do this so as to help both the doctors and the patients to know these things and not just downplay them. So let me know what you think in the comment section. I will do another one maybe subsequently to cover more stuff about this. So don't forget to comment, don't forget to like, don't forget to share, and if you've not subscribed to my channel, please do so you don't miss videos like this. Thank you very much.